Welcome back, everybody. So let's make the great beginning of the quiz. Abhi tak you heard me. Now I want to hear you, right? So let's make the start. 49-year-old Mao adores vaginal discharge and bleeding after coitus. She did not have cervical pap for the past 7 years. She had been on oral contraceptives. And the following is the appearance of her cervix. You're able to see the cervix. Now the question comes, what is the underlying cause for this cervical, which is the cause for her pathogenesis, is a very important question. Yes, doc. Please punch your answers. Question number 1. Yes. Sara Kaderi is saying D. Amrita Francis also. Absolutely. It is a question of cervical cancer. Now, a mentally retarded 29-year-old man from Kolkata. You can see the lesions. This is one important lesion that gives you the clue. Yeah. So, you had a clear appearance of the lesions. Now, what additional findings may be found in this person is a very important question. Shoot your answers, doctor. Sesha Gopalan is the first year student, but I'm just watching. Good, good, Sesha. Bade banke mal banega hamara Gopalan, right? Huh. So that should be the enthusiasm, right? Huh. So please shoot the answers. Amrita Francis says acoustic neuroma. Acoustic neuroma. Yes. Then who else? Acoustic neuroma. So what else can be found? Keep punching answers, doc. I'm waiting for your answers. Question number 2. Yes, yes, yes. Quick, loud answers. Is it rhabdomyoma of the heart or AV malformations in meninges? In meninges, Satya thinks it is neurofibromatosis and answers it as A. No, doc. It is rhabdomyoma of the heart. The patient has tuberous sclerosis, doc. Tuberous sclerosis. It is autosomal dominant and mental retardation, seizures, adenoma sebaceum, hypopigmented skin lesions. So what you find here, what you have seen here, this hypopigmented skin lesion is called ash leaf macule. Ash leaf macule is what you need to basically remember. So it's a case of tuberous sclerosis. You should identify. They have rhabdomyosarcoma of the heart. Similarly, angiomyomas in myolipomas in kidneys can occur. Now, a 32-year-old has been taking oral contraceptive for the past 8 years. She was feeling very giddy and develops abdominal pain. Surgical exploration shows blood in the abdominal cavity. What is the most likely cause for the development of the intra-abdominal hemorrhage in her? Is it hepatocellular carcinoma, ruptured liver cell adenoma, or a cavernous hemangioma, or ectopic pregnancy? So she's a 32-year-old receiving oral contraceptives, abdominal pain now, blood in the abdominal cavity. Question number 3. So looking at it, what is your answer? Give a confident answer, doctor. Question number 3. Amrita thinks liver cell adenoma rupture. Liver cell adenoma rupture. Huh. Ranjit Shaw is proposing ectopic pregnancy. Okay. What else? Any other answers? Satya says B. How about others? We have 18 answers that should come. Dr. Vibha is proposing C. It is a ruptured liver cell adenoma, doctor. Because of the oral contraceptives के बारे में आप ध्यान देना है. Oral contraceptives जो लेते हैं, liver cell adenomas are common in them, right? And they have a tendency to rupture. A 4-year-old boy from Cuttack has recurrent Staphylococcus aureus infections. There are bactericidal and chemotactic defects, right? And you have been shown the smear. Smear में ये cell और ये cell, A cell और A cell. इसको ध्यान से देखिए, right? So leukocyte abnormality and recurrent Staphylococcus aureus infections. So what is your answer, doctor? Is it Chediak-Higashi, CGD, ICEL disease, Job syndrome? What are the possibilities? Yes. So what is the most likely diagnosis considering the all the features put together? Yes. So Sara Kaderi is proposing A. Rajit Shaw also. Vibha also. Absolutely. Chediak-Higashi. So a few points on Chediak-Higashi, doctor. It is autosomal recessive. Defect in the lysosomal transport protein. And there is a problem in the maintenance of the secretory granules. And the granules in this will try to become megagranules. And there's a defect in the microtubular function, the neutrophils, and that prevent the fusion of the lysosome with the phagosome. Lysophagosomal formation में दिक्कत होता है due to tubular dysfunction. So अगर आप इस illustration को इस peripheral smear देखें तो ये जो granules हैं ना डॉक्टर, granules, this is an important clue to say that this is chronic granulomatous disease is what you should remember. Now, this is a lesion of the prostrate gland. Prostrate gland का lesion दिखाई दे रहा है आपको. Gross appearance. दिल लगा के देखो. Prostrate gland का gross appearance you are able to see, right? Now, 77-year-old man, colonel in Indian Army, history of urinary retention, low back pain, and lower lumbar vertebrae shows nodular densities, increased serum alkaline phosphatase and prostate specific antigen is there. What is the most likely cause for the development of this low back pain in this individual? Yeah. Should you answer? What is the most likely cause for the appearance? Yes. Keep punching your answers, doctor. So, Sara Kaderi is proposing B. Ranjit is proposing C. That is important, doctor. Where do you have osteoblastic, osteolytic? Favorite question of the examiner. So, you must be quite sure. Osteoblastic are the ones which you see in prostate cancer. That's what you should remember. Now, this photograph shows a stillborn child. A stillborn child, right? Now, the question is, ध्यान से देखो, stillborn child को. There is increased serum alpha-fetoprotein levels in his mother. Which supplement might have prevented this malformation? Very easy question here. Question number 8. I should see all 18 online punching the answers. Yes, doc. Give one confident answer. Satya Snigdha is proposing folate. Sara Kaderi also. Absolutely. It's a neural tube defect, anencephaly. So that is the reason folate during pregnancy prevents it. Very good. Now, a 74-year-old man is having a dragging sensation in the right upper quadrant, abdominal pain, and weight loss of almost 6 kilos. And there is a blood coating and mixed with stools. External hemorrhoids are there. And rectal examination shows blood mixed with stool. So what is what you are seeing in him is typically his peripheral smear. Peripheral smear को देखे तो आपको क्या दिख रहे हैं और उनके CT scan abdomen. They are the two things that have been presented. And this is a 74-year-old man with a dragging sensation in the right upper quadrant with a crampy abdominal pain. And yes, what is your answer? Most likely possible underlying cause is the examiner's question. Yes, examiner's question. Shoot your answer, doctor. What is the most likely cause? So, Satya, Vibha is saying colorectal cancer, angiodysplasia. No, Vibha is saying colorectal cancer, Satya also colorectal cancer with metastasis to the liver, leading to what you are seeing here, doctor. Here what you are seeing is microcytic hypochromic anemia. Hypochromic anemia. That is what you are able to see. So obviously he has a lot of blood loss, right? So microcytic hypochromic anemia, right? Now, a 56-year-old woman has repeated sinus infections, chronic cough, dyspnea, and urine analysis and chest radiograph are shown. Presenting problems क्या है? Infections, chronic cough and dyspnea. Now chest radiograph is being shown. So what are the various laboratory findings is a very important question. Yes, doc. Laboratory findings. So chest radiograph में क्या दिख रहा है आपको? A very important clue. And what is the most likely possibility? Actually, urine analysis का भी है. उसमें RBC casts are present. Let us say urine analysis is not shown here, but RBC casts are found along with this lesion. So the answer is Sianka. Sianka. It's a case of vaginous granulomatosis. Vaginous granulomatosis is what you need to remember. Right. Now, doc, a peripheral smear shows fragmented RBCs is what you are able to see here. What is the most likely diagnosis in this given case? Where do you see fragmented RBCs? Question number 12. 12. So, fragmented RBCs called cystocytes. One more point I forgot to tell. His PT, APTT are normal. This is one important thing I want to add for you to give me the correct answer. PT, APTT are normal in this person. So this is typically a case of hemolytic uremic syndrome. It can even be thrombotic thrombocytopenic purpura. दोनों में PT, APTT will be normal, right? Now, doc. A 78-year-old man, he shows severe hypertension. There's an epigastric bruit, diminished amplitude of pedal pulses, मतलब उनको atherosclerosis है. Angiogram is being shown to you, right? And what is the angiogram is being shown to you? Now, what is the most best characterizes this patient? इस पेशेंट में क्या होगा? This is the last question for the today's evening. Yeah. Oh, no. There are 3 more questions. Okay. So what is your answer, doctor? You think there will be an activation of renin-angiotensin in the left kidney? Will his aldosterone levels will be down? Will the plasma renin activity will be increased in left renal vein? Or a PRA will be increased in the right renal vein? What is the most likely answer? So gallbladder hypertension is the point that you need to absolutely know. So give me a confident answer, doc. Yes. Question number 13. So what is the most likely possibility in this given case? Yes. What will happen in this individual? Yes. Question number 13. सोच के बताओ, think करके बताओ. Satya proposes D. So which side renal artery stenosis do you have? Right-sided renal artery stenosis. Right? Absolutely. Satya Jindabad. Very good. This question is dedicated to Satya, our future interventional nephrologist. Right? So right renal vein may plasma renin activity will be increased. So fundamentally this patient has renovascular hypertension at the age of the 50 years. Atherosclerosis is the underlying cause for the renal artery stenosis. And any decrease in the renal blood flow, it activates the renin-angiotensin system that lead to hypertension. Now, if you look at the plasma renin activity, it is increased in the right renal vein and it will be decreased in the left renal vein because there is an increase in plasma volume due to increased retention of sodium by aldosterone. An increase in plasma volume increases the renal blood flow to the uninvolved kidney, so it will suppress the renin-angiotensin system of the uninvolved kidney, in this case left side. Whereas the narrowing, wherever the renal artery stenosis is there, that side the renin activity will become increased and the uninvolved side. So plasma renin activity will be increased in the side where there is a renal artery stenosis. That will lead to increased renin, that lead to increased aldosterone, that lead to increased sodium retention, and this increased sodium will go and suppress the renin activity on the uninvolved side. So PRA will be decreased on the left renal vein where there is no stenosis. So no stenosis. This side PRA become diminished. This side PRA become increased. This is one of the favorite questions of the examiner and the basis for discovering how do you identify unilateral renal artery stenosis. A 42-year-old woman has difficulty to swallow the liquids and solids. She lost weight. Vomits are having undigested food. Very important clue. And the photograph is her chest radiograph. This photograph is her chest radiograph. So, looking at it, what do you get the idea about her diagnosis? What is the most likely diagnosis? Question number 14. Should your answer, doctor? Difficulty in swallowing liquids and solids. Yes. Is it gastroesophageal reflux, achalasia, Crush syndrome, esophageal cancer? What's your answer? So, Sureka, Sara, Ranjit, आप सबका फरमाइश से achalasia is the answer. Absolutely. What you are seeing is a massively dilated esophagus is what you are able to see, doc. Now, a 32-year-old man reports that he was eating peanut butter cookies. बढ़िया, भूख लग रहा है. And he began to feel itchy. He then develops this rash. This rash on his body. This is the classical rash on his body. You got it? Now, they disappeared within 3 to 4 hours. So, what is the chemical mediator responsible for the development of this rash? What is that chemical mediator responsible, and from where is that released? Excellent. Vibhaji, Surekha, Ranjit, everyone say mast cells. Absolutely right. So that brings us to the end of the today's evening, doctor. 2.5 hours हम लगातार प्रिपरेशन किया आज. इसके साथ अगर आपको another 5 to 6 hours का इंस्पिरेशन मिले तो हम बहुत खुश हैं, धन्य हैं, right? And you need to go back to the onlinembbs.com video library. You have extensive 600 hours of video content for you to consume in 120 days, topic wise, organized and available. So please take a chance to revise 30,000 questions from all the previous question banks that we have discussed, just the way we have discussed today evening, right? It's more than enough for you to crack the NEET PG exam. Thank you very much. Tomorrow once more we will meet at evening 6 p.m. continuing our journey in anatomy. Thank you.